Welcome to Helix Pharma. Helix Pharma is situated in Puducherry. We are into the manufacturing of many collagen based products, particularly for wound healing. It is an ISO, GMP, WHO certified company. And this is a very casual video to explain you one of our pioneer product, Sortreat. Sortreat is our most accepted product approved by many government as well as corporate hospital across India. We have two Sortreats. One is Sortreat SLR. This is branded as Sortreat SLR. This contains Silversulfadiazine, and another is Sortreat GTN. It contains Gentamicin. And what is Sortreat? How it is important? I am explaining to you. Sortreat is India's first film forming collagen based gel or cream. It is prepared with bovine type 3 collagen in distilled water. It contains no alcohol, no synthetic polymers, no any waxy or oily material or irritating chemicals that may make skin damage or irritation or sensitization. So this is basically how it differs from a normal ointment, because it is very important that you must know why Sortreat SLR or Sortreat GTN. An ordinary silversulfadiazine cream is enough. So what is the difference between an ordinary ointment or with our gentamicin or silversulfadiazine collagen based cream? Any ordinary ointment, take example for a wound healing. Any ordinary ointment in the market, if you take, it may contain 1 to 2% or whatever may be the concentration, an antibiotic or antiseptic, and the remaining above 90%, it is a gel, very inert gel. Mainly it is made with some waxy polymers or microprecision cellulose, anything like that. But it has nothing to do with the skin regeneration or wound healing. This collagen, all of you know, collagen is a very important protein that helps in wound healing. It is well approved all over the world. And we are working on collagen for more than 10-15 years in the company now. So I will explain one by one what are the Sortreat, how it is being used, where it is used, and what are the advantages in detail. I will go with a minimum time. So Sortreat SLR, first come to Sortreat SLR. So Sortreat SLR, as I mentioned, we have 15 gram small tube like this. Then we have 100 gram bottles. I'll open and show you how it look like. It is well protected in an aluminum foil like this. Okay. Then we open it up. Inside we have the bottle. This is also well protected with a wrap sealing. This is 100 gram jar. Similarly, we have 200 gram jar also. And it is available for both GTN and SLR. These two varieties are, two volumes are available for both the products. Okay. Now, where the Sortreat can be applied, how it is applied. Sortreat, as I mentioned, it is an ordinary ointment like, but made with collagen. So there is no complication in application. How you apply, the need not be worried how collagen cream is applied like this. It's a very simple application. Before going to the application, where it is being used, it is a very good product for the chronic ulcers, non-healing ulcers like diabetic foot, bed sore, venous ulcer, and burns. So generally for a lot of pediatric surgeons and venous surgeons are using our Sortreat and SLR for wound healing. And at the same time, 200 gram big jar bottle, 100 gram bottles are being used in many burns hospital for treating the burns. So now how it is being applied on a wound, that is more important. So the first thing is that where you are going to apply the site, whether it is a diabetic foot, a bed sore, or maybe a burn, the first step is to thoroughly debride and clean the wound. For example, I'll show you some pictures. So this is a classical wound, a non-healing ulcer on a diabetic patient. You can see here some sloughage and a lot of dead tissues here and there. So until you without removal of all these things, if you apply Sortrit, you are not going to get the result. So it has to be thoroughly debrided and clean. And after debridement and cleaning, how the wound look like, I'll show you. See, this is the fully cleaned and debrided wound. The same wound I shown before. This is after cleaning. Okay. Now, Sortrit application, after Sortrit application, I will show you how it look like. This is the after application. You just like any other ordinary ointment, you apply it and spread with a cotton gauze or something like that on the wound properly. And preferably after you do this, after applying of Sortrit, we advise to put a paraffin gauze on the wound, then do a dressing. Dressing with whatever maybe you practice by normal dressing. So the paraffin gauze, why I am suggesting is that because the collagen, it dries after some times and there are chances for sticking of the entire material to the bandage. So you won't get the proper result. So ideally, you can put a paraffin gauze. Now, after application, what happens to the Sortrit? I'll explain to you with a small picture. Any ordinary ointment, if you apply it on a superficial place, this is an application before application, just immediately after applying, and this is after half an hour or so. This is in the case of superficial, I am telling you, not in deep wound you cannot see this. In superficial case, you can see the collagen film formation. This film you can even lift it out. So this Sortrit, either GTN or SLR that you can choose, it is extremely good for the superficial wound. It will totally cover up the wound with a thin membrane on the top of that protect from infection, that protect from the insects and all coming and for sitting on the wound, or the dust particles accumulating in the wound. So everything ultimately leading to infection, it can be protected. And once it is applied, you can leave it like that until you wash with the saline or water. It will going to be remain that. Even a superficial case, you can apply it and again you can apply next day till a thick film is formed for the best protection. So these many collagen based products are coming to the market now. Since our introduction, we are the pioneer people to introduce a collagen based ointment to the Indian market. Nowadays many people are coming. Of course it is welcome. But one thing, you please, whatever the product comes to you, saying that it's a collagen based product, this is the confirmation test. If you apply it on the superficial area and leave it for half an hour or 1 hour, it should form a collagen film. That is the collagen based ointment. Many ointment, they claim collagen based, do not have this property. That means maybe having a little bit of collagen remaining the same story of the inert gel or whatever maybe. So this has to be very careful, doctor. When somebody approach you with a collagen based ointment, this is the confirmation test. Now, as I mentioned, the wound should be thoroughly cleaned and everything, and I have shown you one diabetic foot and another wound I will show you. This is a burn. It's a first degree superficial burn. So this is thoroughly cleaned burn wound, and over that you can apply collagen. It will look like this. It will look like this. Okay, then it is up to you. If the patient is inpatient and you have a very good atmosphere in the clinic, you can leave it open. But if you are worried that chances of infection, then you can do a secondary dressing over this. As I mentioned, please put a paraffin gauze over that, then do a normal dressing. You can open up every day, clean it, and again apply. Nothing will happen. It will enhance the wound healing to many fold. At the same time, It protects from infection also. Now, some classical examples of sore treat before application and after application in a severe burn patient. I will show you. This is a patient with a severe burn patient, crossly infected wound with a lot of slough and everything on the wound. Okay. And now this wound we have totally treated with the sore treat and the patient has survived. This is the after debridement. We applied sore treat, spread properly. Then lot of pictures should come after that I am not showing. Did a secondary dressing and cleaned. Okay, then after 7 days, how the wound was looking like. After 1 week, after 7 days, the wound was looking like this. And after 21 days, the patient has totally recovered and discharged. This is a case, one of the clinical case I am explaining to you. There are so many for burns as well as for diabetic foot and bed sores and all these things. So far I was explaining to you regarding sore treat SLR. This is for the chronic wound and burns. Now sore treat GTN. Basically, as I mentioned, both are same. They are made with the collagen, but only the antibiotic is different. Sore treat GTN contain gentamicin. Since it is a mild antibiotic, it is used for the fresh abrasions, maybe in accidental cases, trauma cases, or surgically created wound, suture areas. In those areas, you can apply it. It will, because it is a superficial area, very easy to apply. After application, it will form a thin film and protect, particularly for children. Any wound, any superficial skin damage, skin bruises or abrasion on the face or any other part of the body, this can be applied and leave it. After some time, it is going to dry and form a protective film. Even the kids can wear dress. It is not going to stain their dress. So that is advantage. And moreover, both the product, both SLR and GTN is non-irritating. It will not give any irritation to the skin or it will not give any pain. It is a very soothing. The moment you apply it, you will get a very relief. So these are the salient features of sore treat SLR, and it differ a lot from the normal conventional ointments. As so many points I explained to you. So I request you to please use this product. It is a well approved product. It has been approved by, I am not taking many names to you. It's up to you. You use it and see how the result is. But still a few places in India, there's in Safdarjung Hospital in Delhi, RML Hospital in Delhi. These are all the ethical committee approved and ongoing product in those department. That's one of the important government organization I mentioned. There are so many like that. And another important corporate hospital, if I take in Delhi, it is available in Medanda, Medicity Hospital for more than 5 years. Regularly they are using. Max Hospitals, many branches. Apollo Hospital, many branches. And all over the cities, major cities in India like Kolkata, Delhi. If you go to the middle, Raipur, Nagpur and Tamil Nadu, Andhra. So this is a well approved and well studied product. And thank you so much for listening to this small video clip. Just for the introduction of one of our pioneer product. We have so many other products also. So one by one video, I will explain to you what your product is. And ultimately, at the end, I am Dr. Thacharodi, director of this company. And I have experience of more than 30 years of research on collagen. And I am in the market as well, meeting so many doctors all over India. Because of the COVID, I may not be able to meet you. I don't know when I will be able to meet you, but I would like to meet you whoever see this video. And thank you so much for listening and please support. Thank you.